behalf of the ECOWAS Commission, I want to thank the Social Protection Agency for inviting the ECOWAS Commission to present the ECOWAS Social Protection Framework and operational plan. During this morning, there were some key important themes that came out from the presentation. One, resilient social protection, closing coverage, and financing gaps. These are the key things that came out from the discussion this morning. And really, this is at the heart of the ECOWAS Commission Social Protection Framework and Operational Plan. In this presentation, I will just give an overview of Social Protection Framework and its operational plan. But before then, I'll just talk a little bit about social protection coverage in West Africa and why it is so important, and why when we say the Gambia is championing social protection and it's so important, you will be able to situate it when we look at social protection coverage in West Africa and the implementation arrangements. So these are just the key outline. Now, as we listened this morning, it became clear there were key points that were made. As for the economic community of West African states, one of our fundamental principles is to ensure the holistic well-being of our citizens across member states, and social protection is at the heart of it. It aligns with our ECOWAS Vision 2050, and when we listen to the presentation by the representative of UNFPA, of course, she talked about the Sustainable Development Goals. So this is key to continue to reinforce why we understand that this is a priority for the ECOWAS region. The other justification that I would like to highlight, of course, is that member states and ECOWAS of the ECOWAS region recognize the importance of prioritizing social protection interventions to reduce social and economic vulnerability. Studies have shown 13 out of our 15 member states, and this morning we've heard that the Gambia has had its social protection policy for 10 years, and it's now working to have a revised version. And also, the key issues relating to developing national social protection flows. Now, let me just go with the statistics. According to the World Social Protection Report, social protection coverage and adequacy gaps in Africa are associated with significant underinvestment in social protection. The social protection expenditure, excluding health, reaches 3.8% of GDP, and the data is showing that in West Africa, it's less than 1%. Let me show you the graph. But sometimes when you have World Social Protection Report showing this, and when we show it and show our member states, it's not to show how bad we are. It is also to show what we need to be what needs to be done. So yes, the investment, there's underinvestment. If you look at coverage of at least one social protection, excluding health, you will see that across ECOWAS member states, more needs to be done. We also know that when there are crises within our region, also our member states step up to ensure that, and we saw it during COVID, we saw how all our member states were able to find extra resources to cushion the effect of the crisis on our vulnerable population. So yes, the figures may not be so good across our region, but like has been demonstrated, it's a work in progress. But also, it is to show that, you know, this is why every government in West Africa must prioritize social protection within the region. Now, the challenges, I won't go into it, many challenges. I was just talking to the Nigerian colleague, and also when you listen to my brother Diba, he highlighted some of the challenges also that they are having. You know, limited coverage and scope of social insurance, insufficient development of social assistance scheme, limited access to healthcare programs, inadequate funding of social protection programs, weaknesses in monitoring and evaluation, and when we were just having the discussion, of course, a lot of coordination gaps, insufficient development on programs of resilience to climate shock and humanitarian issues, and of course, enhancing the humanitarian development nexus. So, these are the challenges that as we began as ECOWAS, we decided that we must take a lead talking about these issues. We can't just leave it to the member state. We have to show regional solidarity with our member state. So the social protection framework of ECOWAS is a compass to really demonstrate how we are showing solidarity with our member state, how we can continue to engage with partners to make sure that they accompany not just us as a regional organization, but our member states. So, what is the ECOWAS social protection? It's a shared of minimum standards for a more harmonized approach. It is to enhance accountability and cooperation of social protection between stakeholders and multiple levels. It is to strengthen monitoring and evaluation systems for standard data collection and evaluation practices among our member states. The next thing is Director Diba. When we started developing our social protection, we started in 2017. However, we did not conclude until 2023, where we came here and adopted the framework. So it took us as a regional organization a more longer period, and I can see the Gambia very, very ambitious in their revising their policy and having a new one, maybe shorter than the ECOWAS Commission. Now, what is the vision of the ECOWAS social protection framework? Is to contribute to a more integrated regional community, enabling it to fulfill its aspirations of socio-economic development, both in line with the AU Agenda 2063 and the ECOWAS Vision 2050. What is our mission statement? ECOWAS social protection framework is to promote the implementation of robust social protection systems and its key principles and guidelines among member states across the region. That's the vision statement of the ECOWAS social protection framework. Now, the social protection framework aligns to the 5 pillars of our ECOWAS Vision 2050, which is a fully integrated community of people at peace and enlightened by visionary leadership, strong institutions for sustainable development. We have seen visionary leadership here through your social protection agency, through your social protection policy that you are working on. We have seen this morning also by having an act to have the social protection agency for the Gambia and having a strong institution. These are the key elements of ECOWAS Vision 2050, as demonstrated through your National Social Protection Agency. Now, like I said, there are challenges, and what we've done is to make sure that these challenges are aligned to the objectives of ECOWAS social protection framework. One of the objectives that we continue to promote across our region is inclusive national social protection floors. We realize that it is very difficult for all our countries to have comprehensive social protection, but having a minimum set of floors will allow us to continue to build on. And as I listened to Mr. Diba this morning, it's clear that this is the approach you are busy taking. So, for example, he was saying, look, in terms of the informal sector, we are not there yet, but look, we've begun to have a registry that we identify the vulnerable groups, that hopefully we'll be able to, provide those nutrition support as much as possible, address the needs of persons with disabilities, those older people, and those that are vulnerable, extreme poverty. So basically trying to set up a minimum sort of floors and then gradually building it up. Vertical and horizontal expansion of social protection programs. Again, he talked about it this morning when he said, look, yes, we don't have all the coverage, but at least we have the registry of the extremely poor people that will allow us to have the intervention. Yes, also when he talked about the horizontal expansion, when he says, okay, it's not just to give, assistance for a short period of time, but what is the depth of that assistance and how adequate it is. I think this is a challenge for not just the Gambia, but for all the member states, the adequacy and the depth. And therefore now, with a strong social institution agency, you can, with a strong coordination mechanism, and also, I think one of the best practice is having it under the office of the Vice President. I think that is the key best practice within this country, because then it is able to mobilize all other ministries towards a certain goal. Increase social protection coverage to the informal sector. Mr. Diba, you mentioned it. Promoting understanding of the humanitarian peace and development nexus, that is key. Manage climate change-related risks through social protection. I know that also under the Office of the Vice President, I think another good practice, the Disaster Management Agency is there, NANA is there, and then you have the Social Protection Agency. That will enable, talking among yourself in terms of ensuring social protection measures. Expand the physical space for social protection. I think you are making, I remember he made the reference to the Minister of Finance, but also exploring a lot of other physical space that can generate additional funding. I hope we will not be like one of the countries that really is putting up a tax system that people are really criticizing now. They are already poor. Why do you want to tax them more? So we have to be very, very careful how we also expand that physical space. Or is it the informal sector that is struggling and struggling and struggling, and you have not provided them with the infrastructure for them to move from maybe just a basic household, small-scale enterprise to maybe a small or a medium enterprise, and we are overburdening them with tax and tax and tax. They come to the roadside, they want to sell, and then every time you have the municipal council, putting a lot of pressure on them to tax them, So physical space, yes, but can we look at physical space that does not add burden to those who are really struggling without any kind of support to earn some basic livelihood support for their system. There are places where we can increase the physical space. Those areas where we have waste within our system should be the first point of call in increasing this physical space, not for those women, youth who are struggling to make a living, and then we want to tax them more just because we want to expand the physical space. Provide realistic guidance on the governance, implementation, monitoring, and evaluation of social protection. We had it this morning when Mr. Diba was talking. He talked about the monitoring and evaluation and also the indicators. There is some progress being done here, and we should be proud of the progress that has been made. Now, I won't go so much into the specific objectives of the social protection. I think what I just want to emphasize here is that it allows us to talk the same language. It allows us to focus on horizontal and vertical expansion of social protection program. It also allows us to think about expanding social protection to the informal sector, labor sector, and especially the agricultural, rural agricultural workers, but also a social protection that helps us to reduce the impact of crisis, particularly on the informal economy. And this is why we should really support the work of the agencies. Now, what will I say again, not to repeat, I think is just to say that this is the structure of the social protection. I have mentioned, the vision, the objectives and the principles, the monitoring and the evaluation, the key stakeholders, and the conclusion and recommendation. We adopted it in 2023. We took it to the Council of Ministers, and at their 92 ordinary session in Abuja, they also endorsed the recommendation of our ministers. Therefore, it makes it a legal text of our ECOWAS member states. Now, I won't go into the details of the operational plan. It has 7 objectives, and I'm sure if we look at the priorities of the Gambia social protection policy, I'm sure some of those objectives align to it. And, we can share the soft copy of the social protection and operational plan with you. So here is an example. One of the strategic objectives: facilitate the implementation of training programs for capacity building in the ECOWAS region. That is one of the strategic objectives of the operational plan that we have. The second one, which I want to highlight, is strengthen and expand existing social programs to increase coverage by setting targets to address the existing gap. And for each of these strategic objectives, there's activities, outputs, annual targets, and responsible institutions. Now, what are the implementation arrangements for this strategic ECOWAS social protection? The implementation arrangements, of course, there are 5 recommendations for implementation monitoring, establishment of a reliable political and administrative mechanism, establishment of high-level interministerial committees, establishment of technical committees and working groups, establish effective social protection information management system, and recruitment of technical and academic experts to undertake that data collection and analysis. Now, are we there yet? Not really, but we were able this year to develop a policy brief that will enhance understanding among all stakeholders on the social protection framework, also to be able to mobilize the resources that will enable us to set up the implementation framework and proceed with the member state. So you can see our member states are key and also have a role and responsibility in the implementation of the social protection framework. I won't go very much into, let me go quickly into the roles and responsibilities of ECOWAS, monitoring and evaluation of social protection policies and programs, advocating for adequate funding to be allocated by member states for social protection, enhance regional learning and promote cross-learning opportunities. And this is where this meeting is so important, and we are really, as a regional organization, demonstrating our solidarity with this conference because it enhances learning and promotes cross-learning opportunities. Periodic reviews, monitoring and evaluation of social protection systems, update or develop national social protection policies, and this is again where you are moving ahead very quickly. Ensure National Statistics Office collect relevant data to inform design and implementation. Share good practices and models with other ECOWAS member states. Progressively reduce and eventually eradicate the gender gap related to social protection. And enhance coordination mechanism. Progress reports on the implementation of the social protection policy and programs to the ECOWAS Commission. Strategic guidance on the direction of social protection, support member states in their design and implementation efforts, monitor and evaluate outcomes across ECOWAS, facilitate cross-learning opportunities among our member states. So, I'll just go, I don't know whether I missed the member states. I think role of civil society, I think, you know, I've mixed it up. Member state roles, we have roles for African Union, civil society, including the private sector, and also development partners. And we have had a number of series of meetings with all the development partners, World Bank, FAO, UNICEF, World Food Program, as we continue to engage with them. So, the key messages that I want to leave with you here is, one, create an enabling legal and policy framework and accountability structure for social protection. And we have seen that very, very well presented this morning by Mr. Diba. Develop rights-based national social protection flows based on each country priority areas and facilitate access to health care. The big challenge is that of allocating adequate funding for social programs, social protection programs, relying primarily on domestic funding sources to ensure viability and sustainability. Again, that is another area where I have really emphasized in terms of expanding the physical space. Provide social protection to the most vulnerable groups, vulnerable individuals and households, to ensure that negative coping mechanisms do not adversely affect vulnerable categories, especially children. Again, we listened to this morning, identifying the most vulnerable population, but you are doing that through the social register. Now that I have the register, anytime ECOWAS is giving money to Gambia, I will say, bring that register out. Bring that register out so that we can see that what we are doing aligns and is in coordination with your National Social Protection Register. Develop a viable monitoring and evaluation framework. We had it this morning. Collect data and generate evidence on the implementation of social protection programs to inspire policymakers, practitioners, to effectively contribute towards the achievement of the Sustainable Development Goals. So, distinguished ladies and gentlemen, this is the overview of the ECOWAS Social Protection Framework and Operational Plan. It's a work in progress, but we believe that if you don't have a roadmap of where you're going, you are not able to talk to partners, you are not able to develop action plans or mobilize funding to support or express regional solidarity with our member states. I want to end by commending the Social Protection Agency, because what they did this morning by looking at where they were in 2015 and where they are in 2025, they've been able to open themselves to say, hey, this is where we are 2015, this is where we are in 2025. I hope for the generations to come, they will be able to pick the ECOWAS social protection framework and say, this is where we are also. And maybe in 2034, say, look at what we have been able to achieve. That is the essence of a policy document. I will just want to use this opportunity. I see Mr. Diba is not around, but I want him to hand over this hard copy to the Vice President of the ECOWAS, the Vice President of the Gambia. Who will collect it? Deputy Executive Director, sir. Okay. You know, when you have worked on a document from 2017 and you finally get it out, we couldn't have done it without the Vice President of the Gambia. He came and opened the expert meeting. He came and opened the ministerial meeting for us. We want to hand him over this ECOWAS social protection framework and the policy brief here, with the picture of the Vice President and the key ministers who were there, saying that he played an important role in the history of social protection and the Commission, and hopefully 10 years later, just like you have looked at yours, generations will remember this, and they will be able to look at the plan and say, where were we, ECOWAS, in 2024? And you, the younger generation who are here with us, I'm sure you'll be able to say, well, they did their best, but this is how far we have come. So please hand it over to the Excellency, the President, Vice President.
Sorry, thank you. One more. Over here, please.
Over here. Let me adjust my glasses. Thank you. Thank you, Mr. Dipa. Yes.
Thank you very much for that, Dr. Sintiki. Do we have any questions or comments on the framework, on the ECOWAS Social Protection Framework? Any comments, any questions, any observations that you would like to share with Dr. Sintiki before she leaves the stage? Okay, I believe there seems to be none. Okay, that being said, we would move on to our next presentation, and that would be done by...
You're like me, eh? You don't like this photo.
Okay, so we'll move on to our next presentation, and that will be done by Mr. Malang Fofana, the Director General for National Nutrition Agency, that is NANA, and he'll be presenting on building resilience against food and nutrition insecurity, a case of the NAFA program. So if you have any questions as during the presentation is going on, please just note them down.
Thank you.
And then after his presentation, we will take a few questions. Thank you.
Thank you, moderator. Good afternoon. Let me stand on the existing protocol to recognize all the dignitaries present here and those that are online. I'm glad to share the case of the NAFA program at this second Gambia International Social Protection Conference, showcasing the work that we have been doing as a government over the past few years to try to address the issue of poverty, food insecurity, and malnutrition in the Gambia. NAFA is a local name that means benefit, but it also means a pouch that usually women tie at their waist when they are selling and they put their money in. When we are conceiving the NAFA, we try to look for a local name to signify the NAFA. We came to agreement that hence we are looking at a cash transfer, which is handling money, and NAFA is a pouch that women usually handle money in. But the benefit of the NAFA money is for the entire family. So it fits very well into our local language. And we choose NAFA as the program, which is a cash transfer that goes along with social and behavior change communication to build resilience of the household. So in this presentation, we will look at the scope of the NAFA, the selection criteria, why do we combine cash transfer with social and behavior change communication, how do we deliver the program, what are some of the key achievements that we have seen through the impact evaluation that we have inbuilt into the program, but also some of the monitoring framework or approach that we use. We will look at sustainability approach as far as NAFA is concerned, some of the lessons learned, and few recommendations. NAFA was part of the phased out social safety net project, SSNP, a government initiative supported by the World Bank that combined cash transfer and behavior change communication to improve welfare of households in the country. When the SSNP phased out in 2023 December, and the Gambia Resilience, Inclusion, Skills, and Equity Project, the RISE project, was being designed, it was included in the design of the project to extend and expand the NAFA program into that project. And now the project is in the RISE project as part of component 3. The aim of the NAFA program is to provide social assistance to households to improve smoothen consumption, reduce vulnerability, and allow households to meet basic needs, especially in terms of the social needs, health, education, water, sanitation, as well as help them invest into livelihood to improve human capital development in the country. This is the aim of the program. How do we identify who should benefit from this program? We know vulnerability is wide, but by design, this is meant to address poverty, particularly extreme poverty. So in trying to address extreme poverty, we have to identify who matters most. And to help us identify the targets, we use certain criteria. First, we look at, among the districts in this country, which are the poorest districts. We don't just sit out of the blue and say, it's Jara West, or Jara East, but we look at the data to identify which districts are the poorest districts. We use the integrated household survey to look at poverty gap and poverty headcount ranking. And these two help us to identify, to rank all the districts from 1 to 42. Based on that district ranking, we start with the most poor districts. Based on the envelope, our initial target was to go into 20 districts, but now we are going beyond 20 districts. The second level is within the district, how do we identify the extreme poor? The social registry that we are proud today, that has a national coverage, is what we use to identify the vulnerable or most eligible for this program. And they use proxy mean test, apply on the household data, to tease out who are the most vulnerable, who are the extreme poor in the communities. And this list is what we get back into the communities to validate, for the community to identify, yes, this is a household that lives in this community, and the name of the household is X or Y. And those are the ones that we enroll. All the eligible households that are validated are enrolled in the program. The program is implemented by NANA in collaboration with the Community Development and Social Welfare Directorate. It focuses on building resilience of extreme poor and households for food insecurity, to address food insecurity of the poor household. When we start the program, we start from as a pilot in 3 districts. The 3 poorest districts that were identified from the integrated household survey was Nyanija, Wuli West, and Fonyi Bintang. And within those districts, we have 2,770 extreme poor households that were all included in the program at the time. And I'm glad to inform you that in May this year, they have all received 36 months of cash transfer with SBCC and have phased out. Later on, we enrolled 17 other districts from the 20 target districts. And this district, among them, we have 14,196 extreme poor households that we are all included again. We don't want to leave any extreme poor household in those districts, so we include all the extreme poor households in those districts, containing 802 communities in CRR, URL, LRR, and the North Bank, which is only one district, Sabah Sanjak, at the time. As we speak this year, around this time, we are now expanding to 16 other districts. We will include all the rural districts now are going to be included in the NAFA, from Lower Nyomi, Upper Nyomi, all the way down to Basse. We will include all the districts now, and the target is 14,963 households. Later on in 2026, our target is we will expand to the Combos, Banjul, and KMC. So we expect that by next year, we will reach national coverage for NAFA as well, just as we reach national coverage for the social registry. Our target is to reach 36,000 extreme poor households in the country. Meaning we will have 100% coverage for extreme poor households with the NAFA program by 2026, inshallah. The payment mechanism that we use for the NAFA, when we are conceiving the program, we conducted a study to look at the food basket. What is the cost of a food basket? And we know it will be difficult to meet the entire 100% of the food basket. So we look at the package, and based on comparative analysis done in the sub-region and globally, we take our cash transfer value to 1,500, which equates to about 15 to 20% of the food basket of an average household of 8. And this is paid every 2 months. We pay 3,000 every 2 months to reduce the administrative cost of the program. And each household that is included in the program is in the program for 36 months for 3 good years, meaning they receive 18 cycles of payment. We use cash, direct cash delivery, cash in hand, and also an e-money. As a country, we have to also abreast ourselves with what is happening globally. So we also try to see how do we include e-money. So we use one whole region to test the e-money and use 4 regions to do the direct delivery. In the payments, we identify payment service providers based on their capacities, based on the technical services that they offer, the geographical coverage, as well as the cost and quality of service that they offer. Why cash transfer and SPCC? The cash transfer is meant to help households meet basic needs such as diversified, healthy, and nutritious diet, and access to social services. That's why we're giving them the cash. We are dealing with extreme poor, and the extreme poor find it difficult to put food on the table. So we give them the cash to help them to meet those basic needs, particularly diversified diet. We combine this with SBCC to improve households' understanding, adaptation of behaviors that will help to improve health and nutrition, early childhood development, adolescent and family planning, parenting and child protection, prevention of gender-based violence, agriculture and climate change, as well as positive playful parenting to stimulate and upbring our children, as well as ensure that we inbuild into the poor household the idea of entrepreneurship and financial literacy for them to be able to engage in meaningful income-generated activities, so that when the cash transfer ceased, they'll have something to lean on to have an extra income for the household. And this has been now linked to productive and economic inclusion as a phase-out for the NAFA program. How do we deliver the program? Particularly looking at the behavior change communication aspect. For SBCC, we use several platforms, one of which is the airing of sports. In all the modules that we have mentioned earlier, including the health and nutrition, the early childhood development, adolescent family planning, all these modules, we develop sports for them. And these sports are aired in 18 community and private radios, the GRTS, the TV, and QTV. We hire those services of those stations, and every day or every other day, they hire a particular module for 2 weeks. At the end of the 2 weeks, we conduct panel discussions. The panel discussions are meant to strengthen what is being discussed during the sports, but also it is used as a refresher for the interpersonal communication network. We're using the IPC networks to deliver SPCC at the grassroots level. And in the project, we bought or procured radio sets for all the IPC members. When we are doing the panel discussion, we encourage them to tune into radio so that it serves as a refresher, as a reminder for them during that. But at the same time, when we are doing the panel discussion, we open lines for people to make calls, ask questions or clarifications where necessary. Again, we also do coaching and mentoring to build capacities, to strengthen and support grassroots implementers in their delivery of their roles in the project. We also use on-site SPCC. When we are delivering the cash transfer, anytime we have cash transfer, we choose a topic among the modules to deliver directly to the beneficiaries before they receive the cash. So anybody who comes to receive the cash, you follow the SPCC to understand the topic of discussion. If you have any questions, you can ask questions, and clarifications are made before they actually receive the cash. For the interpersonal communication networks, they use individual counseling. They counsel individual members of the household or beneficiaries, but also do group counseling where they bring a group of people together to discuss with them about the module or topic. They also play role plays and dramas. They do home visits, and of course they do entertainment education where they will sing, dance, while singing and dancing, they'll put in key messages into the songs and dance. Of course, we also have the community facilitators. These are people who live in the community, and they conduct specific sessions for those household members who have children 0 to 3 years to stimulate and improve child care among those members. That's how we deliver SPCC across the regions. For the M&E, we deliver M&E through conducting supportive supervision. This helps us to try to verify that the implementation of the activities are going according to plan. We also assess capacities of the stakeholders, especially the IPC networks, the MDFTs, as also look at what are some of the bottlenecks that we are facing in the implementation. Then we also do what we call beneficiary satisfaction survey. This is an M&E strategy that helps us to assess how satisfied are the beneficiaries with the implementation process that we are taking on, with the quality of services that we are delivering, and of course the security arrangements that have been done at the time of the cash transfer. In the last that we have done this year, we have seen high satisfaction rate, as you can see on the board, in terms of waiting time, in terms of waiting condition at the payment side, in terms of security at the payment side, in terms of the services of the payment side providers, and the access to GRM mechanisms. All these have higher satisfaction from the point of view of the beneficiaries. This is done by an independent people that are hired to go and select and interview households based on how satisfied are they with these processes. And also, of course, in the SPCC, we also look at what are some of the modules that they can remember very well. And if you can see, health and nutrition has been one of the modules that are highly understand and remembered by the beneficiaries. The lowest that is being remembered by the household is climate change and economic inclusion. So this will help us time now to focus more on those ones that are lowly remembered during the BSS. The other mechanism we use is the post-distribution monitoring. This helps us to monitor the use of the cash. Where are people putting in the cash? Who is responsible for making decisions as far as the cash is concerned? And you can see that it helps us to ensure that there is a joint decision making when it comes to the use of the cash in the house. We know husbands are the head of the households. We anticipate or encourage households to identify women to be the recipient of the cash. But who decide where to put the cash into? We have seen that now it is joint decision, mainly it's a joint decision among households, that the husband and the wife and members of the household will sit and decide where to put the cash that they receive from the project into. Then we have two important evidence-generating M&E systems, the panel analysis and also the impact evaluation. The panel analysis is a longitudinal study that identifies a group of beneficiaries at the beginning, before the cash transfer, and every year at the same time we follow them to see whether there are any changes in the household. We measure changes in the household, particularly focusing on 4 key indicators. One, we look at the food consumption score. Are they consuming diversified diet? Are they doing any savings? Are they using investment into productive economic that can yield some meaningful income for the household? And how are they grasping knowledge, attitude, and practices relating to SBCC based on the modules that we are offering? This is done every year. We have started this 3 years ago. We have done the baseline, the follow-up, and the last follow-up. And this year we'll do the fourth one. And we have inbuilt an impact evaluation that quantifies and explains the changes in poverty reduction brought about specifically by the NAFA program. And I'm glad to share with you some of the findings from these two M&E strategies, the impact evaluation and the panel analysis. That shows that this project has built resilience of extreme poor households. Remember, we are talking about extreme poor households that find it difficult to put food on the table, that have difficulty in making their basic need of health, education, water, sanitation, even shelter. And this project has an impact on them based on the finding from the impact evaluation as well as from the panel analysis. One thing that we have discovered is women empowerment. We know when women are empowered, the household is empowered. When you empower women, you empower the men as well. And this project has helped us to empower women. Both studies have shown that women are empowered. In the project, yes, the cash is meant for the household, but those who receive the cash, 96% of them are women across the country. It helps women to participate in decision making, in how and where to invest the cash into in the community. Yes, we know still, at the end of the day, men still have the control, largely have the control, but women are empowered to participate, to bargain as to how the cash should be used. That's one thing that we have discovered in the impact evaluation and also the panel analysis. We have seen that it has helped us to improve food security among the households. Both impact evaluation and panel analysis have shown improvement in food security. For the impact evaluation, improvements are there. What they try to do is how significant is the impact, is the improvement. That's what the impact evaluation try to find out. Yes, it is there, but from the evaluation perspective, the improvement is not significant as far as the analysis is concerned. However, it has shown that cash transfer can improve household food security, enabling beneficiaries to eat better food, to eat 3 square meals a day, despite limited funds. That is what the impact evaluation has shown. The panel analysis, on the other hand, looked at diversification of the diet. Food consumption score has improved over the years. Household food consumption score has improved between the baseline and the follow-up by 8 to 11 percentage points over the period. After 1 year of suspension, there are still households that are maintaining good food consumption score. I want to remind this gathering that when the Social Safety Net project ended in 2023, the cash transfer ceased for a year. During the course of that year, before the Gambia rights became effective, we are not giving cash transfer, but despite to look at what is feasible for a household of 8 members, a household of 12 members, a household of 20 members, and a household of 4 members. If you give a household of 12 members 1,500, a household of 3 members 1,500, the impact will be different. So we have to look at that dynamic in the future. We also have a complaint SPCC. In terms of knowledge and practices, we have to also complement this with life skills training, particularly focusing on entrepreneurship, financial literacy, investment decisions. This will be very helpful in building resilience for the future. We need to strengthen our targeting and the grievance mechanisms so that no complaint is left unanswered. By further engaging communities in the criteria for identification, by ensuring that the GRM system is accessible to everybody without any conditional or problem. We all need to continuously improve on the payment mechanism to reduce the burden on logistics to the beneficiaries. The world is going digital. We have to see how do we align digital technology to deliver the cash, but also enable us to carry out behavior change communication sessions at the same time. We need to explore the complementary interventions such as school feeding program to leverage on the positive playful parenting that is trying to improve child welfare, stimulate child welfare, prepare them for enrollment into the school. So this also can also leverage on the school feeding and others. We have to ensure that we enhance gender transformative programming that directly address barriers women are facing. Like I said, if you empower women, you empower the entire household. If you empower women, you empower the entire nation. And this is what INAFA is doing. This is what we expect every program in this country to do to enhance resilience. Thank you very much.
Thank you very much for that presentation, sir. So do we have any questions, any observations from the NAFA presentation? Does anyone have a question? Any observation? We have one. Okay.
Thank you very much. The name is Mohammed Dikobala. I'm from Nigeria. Well, not really a question, but a commendation in terms of even the naming of the program NAFA coming from the cultural perspective. Unlike, sometimes you have it around the world, cash transfer directly, as a project, national cash transfer program. But now you have NAFA coming from, the way you said, the pause for women. And most often, sometimes even the name cash transfer pose a threat to the implementers. Some of these people think the money you are giving to the communities belong to you. So most often we have our facilitators, as much as lower as the community facilitators, being attacked in their houses, thinking that all the monies are in the stock list of the national coordinator. So sometimes it's good to go by, and it will be better, it will have a better understanding. Well, my question again is, when COVID hit, most of our registries are coming from the rural perspective, and the data are from the rural, and then COVID, most people are affected, that are affected are in the urban areas. So what were the systems in place, to extend, assistance? Though I know, but strategically, the government will rely on your office and that of the national, where the registry is, for them to now say, okay, when COVID hit, there was this restriction of movement and what have you. We are not there yet, quite all right, but what are the initiatives by the government of Gambia to deliver assistance during COVID and you know, anticipated shocks, economic and what have you, that, including disasters that are coming. You know, there should be a strategy, a roadmap for that. And then lastly, it's about, you know, the allocation of these cash transfers based on households, communities, and I know the communities and locations are sorted because you know you use poverty maps, but the number of households within the communities, you know, there's a lot of political economic questions that may arise in terms of, okay, how do you now apportion a number to the communities? Yeah, quite all right, the communities are selected based on poverty maps and what have you. We agree based on this, but what of the households? What are the strategies used in selecting the number? Okay, now we are giving 10 to South region, 5 to Eastern region, 6 to Eastern region. What were the, you know,
approach
that inform the decisions? You know, is it okay, this is the hometown of the vice president, give him 10. The hometown of the president, you know, oh, I'm the coordinator, look at the registry. I need, you know, there is these political questions. So how do you contend that and resolve that? Thank you very much.
Thank you, Mohammed. Another question. Okay. Let's take a few questions.
Thank you very much, Mr. Fofana. I would want to start by putting on record or placing on record my sincere thanks and gratitude for the very good job you have been doing over the period. I am Ibrahim K.S. Damfa, former governor, now deputy ombudsman. I want to thank the agency and Nana, as it were, for all the good job you have been doing. We've heard from Mr. Deva earlier in the day, during his presentation. In the 15 minutes he was able to impress us with all what you have been doing for the Gambian people. It's a very good job you have been doing. At the initial stage, I'm sure Mr. Barra would confirm, I was among the first set of governors who were called upon to be part of this crusade from the start. And I've seen it grow from strength to strength. And what the people have been doing at Nana level with the NAFA project is very much impressive. And I want to thank you for the very good job you have been doing. I am also happy to note that you would want to expand because of the success story that it has been so far. The Gambian people want it to be expanded. I know there is a lot of poverty in this country. When you talk about rural poverty, just come down to urban poverty. Poverty is a cross-cutting issue. Sometimes you think that once you are in the Combos, where perhaps there is a lot of money flowing around, you think there is no poverty there. But I can tell you from experience that there is a lot of urban poverty in this country, and you need to expand as quickly as possible. That takes me on to what the previous presenter, Madam ECOWAS, I'm sorry if I say Madam ECOWAS, you talked about the horizontal expansion, and in your mission statement, not the vision, but the mission statement for the ECOWAS framework, you mentioned care to be given to the horizontal expansion, that we have to be very careful. Rather than helping people, government may not want to expand, come up with policies, to make people suffer, to give them more burden onto to increase their crisis. What I want to know from the ECOWAS angle, what would be your advice to the, now that you know where we are at the moment, you have been there with us along the way, what is your advice to government? Yes, the political commitment is there, but it's important that you give us your advice from that level ECOWAS level, so that we can avoid, rather than taxing, more taxation on the people, rather than helping them, you start to give them more burden onto their crisis already. So what would be your advice for the government and for the agency to be mindful of? I remember at some point in my earlier years as a teacher, there was this issue of $1 as a policy, taxation on $1 each across the board, so that as an education fund. So if the government is to avoid that, what would be your advice to safeguard against such things? And Malam, finally, quite apart from thanking you for all you have been doing, I just want you to throw more light onto, I know that you are using what you call integrated household data that you have been using. I want to know how frequent is the update of your data. Poverty is a cross-cutting issue, and it's never dynamic. It's dynamic. It's not static. You will know that because in the same hall here, there was at some point there is a lot of money coming from outside to this country, and one household's poverty in September may change in October. So I want to know how dynamic, how frequent is your data upgrading, because it's important to know for you to determine whether your integrated household data is static or it is dynamic in terms of operation. Thank you very much.
Thank you so much, and Ofana, thank you so much. And my name is Obasa Peter from the small Republic of Kenya. I was just going to echo what my colleagues have just said about community targeting. And as you know, the demand for money is more than the supply for money. How do you manage the politics around the community? How do you manage the gatekeepers? How do you manage the political class? And how do you manage yourself? Because that is more important. You are a family and you must be able to defend your family. How do you manage yourself vis-a-vis the program? I want to look at the slide that you presented about the expenditure that goes to the community, to the cash transfer, vis-a-vis the expenditure on program functions. If I remember very well, it was 55.6%, 4.9, almost 56%. That is the funding that goes back to the beneficiaries. That leaves you with around 40%. Don't you think it's a little bit higher in terms of administrative costs, because the entire bulk that is left is purely administrative? And if that is the situation, how do you reduce it so that more money goes to the community to change the lives of the community vis-a-vis more money being on administrative? Because even SBCC is purely administrative. Every other thing is purely administrative. And finally, in your research work, there's a segment that has just been avoided, whether intentionally or otherwise. Persons with disability. Where are they? Or Gambia is different, you don't have people with disability. The nutrition angle affects especially children below 3 years who have CP, Down syndrome, and the rest. What are the results of the impact telling us? Maybe you might have forgotten it in your presentation, but how are milestones achieved with the program intervention that you have put in place so that we can see, yes, the program came to address the challenges of disability, especially the first 36 months of growth. That's critically important, especially for nutrition persons like you. You might want to understand whether the program really targets and really changes the lives of those who are living with disability, not living those with disability, so that at least it can be addressed. Thank you so much.
Thank you all for the compliment and the comments, as well as the questions. Let me start with my brother from Sister Nigeria, Mohammed. Mohammed, thank you for the comments. The question of the COVID-19, how do we deal with COVID-19? You know, COVID was a menace across the continent, including our own Gambia. And as a government, we also have our policy that restricts people from moving. So during time of COVID, we took some part of the project fund to do a near universal cash transfer, because this came at a time when we were facing the lean season. At the time, food insecurity is higher because the old harvest has almost run down, the new one unripe yet, and people are now restricted to move out, particularly those who feed on their feet. I mean, those who go out daily to fend for something to put on food on the table. You ask them to stay indoors, not to move out, it becomes challenging. So we do a near universal cash transfer that we give cash to those households to enable them meet their basic need while they stay at home to cope the threat of COVID-19. And in that, we were able to meet about 78,000 households we are supported with cash transfer on 2 occasions to meet the basic need. On how do we apportion allocation of households to communities or districts? This is taken from the social registry. Social registry, like Mr. Diba have said earlier on, is a pool of data that has every characteristic of the household, every household in this country. When we apply the PMT, we do a ranking. And the ranking will tell you these are the people who fall under your cutoff point. And based on that cutoff point is where now households identify where they belong to. So there's no need to say, nowhere where we say, in this community we'll give them 10, this community will give them 20, no. The list comes from the social registry that determine where households are going to come from. As we speak now, currently we are expanding, and in one community, one very high political figure says, you gave my community only 13 households, and it's a big community, so we need more households. But what we explain to him is that we don't determine the number of households per community. That is determined from the data that we have in the social registry. It's only social registry that determines what percentage or what number comes to each community based on the PMT score. I think that answers your question. My elder brother, Mr. Damfa, the question of expanding to the urban area. Yes, urban poor exists. There are poverty in urban areas. We are very sure of that. Even the integrated household survey shows that poverty is high in one area. But the difference is how far are you from the poverty line? The data that we use, we look at how many people are poor, but how far are they from the poverty line? So that we can help those that are very far from the poverty line, we try to bring them closer to the poverty line. That's the approach that we're using. So for the urban areas, we are expecting that by March next year, inshallah, we will reach the urban areas as far as the NAFA is concerned. How frequent is the data updated? When the project was designed, when NSPS was established, the initial focus is to have a nationwide coverage with the social registry. And I'm sure Diba and team will add more to this explanation. Once we have national coverage, now we are thinking of how do we update the data. There are mechanisms that have been put in place to keep on updating data, and I think one of them that Diba already mentioned in the morning is linking this to the CRVS. So that anytime there's a birth in the community, automatically it will fit into the social registry and it updates itself. If there's death in the household, it will fit into the system that automatically update the household. So we are now thinking of how do we update the data. I know currently the NSPA is working on updating the current data that we have by going into the communities to do another kind of exercise to look at the dynamics. But yes, poverty is not static, it's dynamic, it's changing. I can report rich today, tomorrow I become poor. It's possible, all is possible. But we have to base it on strategies and how feasible it is to do that often. To my brother from Kenya, thank you for the compliment and also the questions. How do we manage the communities, the political dynamics? One thing that we have done as a program is we try to ensure that all those who matter, particularly those who are making decisions, are involved at the beginning of the program. We organize orientation for policy and decision makers, the governors, the tax, the National Assembly members, the chiefs, the councillors in the regions. We are all oriented about the programs, the modalities, the eligibility criteria, the implementation arrangement, and so forth, so that they are aware of how the program is designed, how it is going to be implemented across the country. So that's the first thing that we have done before we get into even the cash transfer. We are able to inform, educate the authorities across the regions so that they understand. Rather than them asking questions, they should be able to answer questions when those questions arise. And some of the governors are here, they can attest that. We have a meeting in all the regions to discuss about that so that we can quench the issue of queries and complaints from key political leaders in the community. How do we reduce the cost? Yes, that's the focus that we're trying to do. The NAFA, when it's been designed, every time we don't have systems in place. And we have to put the systems in place. And in building system in place, you have to allocate resources for that. So it has helped in the establishment of the NSPA. The funds came from this. In this establishment, we also support the social registry, data collection, the MIS, all came from the port. We also have capacity building that came out across the port. But like I said, when we are going into this kind of program again, the administrative cost will reduce because we are now focusing on how do we leverage on the digital power to deliver cash, deliver SBCC at minimal cost. So that's the focus of our future movement. How about the person with disability? Every program has its designs, it has its limitations. One limitation of this program, it doesn't specifically target disability, but they are not excluded as well. Any household that have a person, because the unit of target in this program is not an individual, it is the household. So the household criteria is what we use to determine who is eligible or not eligible. If it's an individual, we will have identified categorically this is our target, but this is a house program that specifically target household rather than individual. But if there are any household that has a disabled, we give whatever is required to help the household. And I can tell you in one of our most significant story, there is one lady in Diabugu who is a disabled. Today, you go to that house, that lady, he is an entrepreneur, thanks to the NAFA program. So anywhere we have the disabled, we give them priority to make sure that they are included in the program. So I think that answered all the questions, unless if there are any other questions. Yes, yeah. Yes.
Yes. Thank you for that excellent question. I think you were asking the question in relating to expanding the physical space. And ILO has a full technical guidance on that. I'm not the ILO expert, but there's a full technical guidance on that. I think the key thing about expanding physical space is to make sure that, you know, when you are looking for increasing resources for social protection, there are two principles. You have to ensure that it is equitable and sustainable. And one of the areas, of course, is tax, increasing tax, which I dwelt so much on the example that, you know, everybody said, oh, we're not collecting as much tax as we should, and therefore we should increase tax collection. And I was saying, let's be very, very careful if we want to expand the physical space through taxing. You know, my understanding is that you don't tax the poor again. And when you are not giving them the services, electricity that they need, water that they need, health insurance, and then they are trying to run their business and you want to now tax them further. I think this is why I'm saying, yes, increase the physical space. But I think when we listen to DIBA, and let's go back to Gambia, there are so many areas that our member states are already doing very, very well in terms of trying to allocate from our national budget. For example, I know there's some budget going for social protection. There are areas where we have excess, you know, subsidies. Nigeria, when they removed the oil subsidy, I think they channeled more resources to help the poor. That's also an area for expanding the physical space, reducing inefficiencies in government. And I know that a lot of the areas where we have inefficiencies is in our procurement process. If we can make sure our procurement process are transparent and accountable, we can save money that can go into social protection. You can see when you look at that coverage, you may ask, why is Cape Verde very, very high there? We've learned that in Cape Verde, for example, they are taxing a lot from tourism also and plowing it back into their social protection system. So looking at all that spaces, there are some that are, you know, you're lucky, you don't have open conflicts here, you don't have terrorism. For some other countries, a lot is going into the fight against terrorism. A lot of military spending, it's going in there. And therefore, it's taking away the resources that should go to health, education, and other things. But here you have the advantage of really, you know, a peaceful country, you know, how you target resources for that. But there's a whole ILO guideline on that. Kenya, I know, on physical space, and I've just given some examples of, again, another area where we are seeing our member states doing very well is Ghana with the health insurance. You know, if you give health insurance to very poor families also, it really helps, because one of the things that increases the risk of the informal sector is when people fall ill. When people fall ill, they have no access to health facilities. You are not well. How can you even go to the market? You know, you just suddenly fall from somebody who is trying to take care of your family to suddenly somebody who does not have, cannot go out and fend for themselves. So we've seen countries like Ghana where they've invested in health insurance that is going well. Another thing that we're seeing very, very good is the child school feeding programs. How do you enhance school feeding programs also? So I think this was what I was just trying to emphasize, because the informal sector is the most important, vibrant sector in our economy in West Africa, but it is also one of the sectors that, we have very, very poor social protection coverage. For we as government workers, through either contributory or we are taken care of. But what about that informal sector? And let's be careful that we don't overtax those we cannot even give the minimum support to run their business. Thank you.
Thank you.